Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor, and today I'd like to talk to you about what is metastasis, also known as metastatic disease or metastatic cancer. These are all the same thing, and I've been asked by various patients, what does this mean? And I've noticed there's a lot of confusion when it comes to this word, so I thought I'd clarify this a little bit. So first of all, metastasis is, by definition, when cancer has spread from its site of origin to another area of the body. I'll give you an example. So let's say you have a patient with lung cancer, and unfortunately this lung cancer has spread to another area of the body, for example, their bone. Now, this does not mean that they have bone cancer, but this means that this lung cancer has spread from the lung over to the bone. So now they have metastatic lung cancer to the bone. I've noticed in this example, I've noticed patients will tell me, well, wait a minute, so this means now I also have bone cancer? No, it's the same lung cancer which has spread to the bone. And this can happen with any cancer. So for example, breast cancer, prostate cancer. So let's give another example. Let's say a patient has breast cancer, and that cancer has spread from the breast over to the liver or to the lung. Again, it does not mean that they have liver cancer or lung cancer. No, it's the same breast cancer that has spread to that other area of the body. And this is the definition of cancer. And unfortunately, this is how cancer kills. These cancer cells want to spread to another area of the body. They want to grow, and then they start to compromise the function of that organ. So in that same example, if that breast cancer spreads or metastasizes to the liver, it starts growing within the liver, and now that liver is impaired. It cannot work the way it normally would. So the patient may start developing liver failure. If you have a cancer that metastasizes or spreads, it's the same thing. It just means cancer that has spread, and it spreads to bone, and now it's encroaching upon your bone. You may develop bone pain, or if that bone becomes very weak, you can develop a fracture. That's also known as a pathological fracture. So overall, we use this terminology very often: cancer, metastasis, metastatic disease. It all means the same thing. It's letting you know that a cancer has spread from where it started to another area of the body. Now, cancer can spread by a few different mechanisms. Number one, it can do so by direct extension. So I'll give you an example. Let's say you have colon cancer, a patient with colon cancer. Well, that cancer can penetrate the colonic wall and spread to other areas within the abdominal cavity, within your abdomen. So any other organ that is around the colon, if that tumor penetrates that colonic wall, that colon, it can also spread to other organs of the body. Another way that it can do so is these cancer cells, if it penetrates the basement membrane, I know this is medical terminology, but in other words, this cancer starts to grow, and unfortunately, it penetrates the cell and it makes it into our bloodstream. Wherever the blood goes, it can also provide a vehicle as to the development of metastatic disease. In other words, these cancer cells can spread through our veins and our arteries to another area of the body. Now, this is much less common in our arteries and veins, and when it does so, it's usually a vein, and it usually ends up within the lungs. This is more common for rare tumor types, like for example, sarcomas. Again, very rare tumor type. A lot of times it'll spread through our arteries and veins, and it tends to develop, and patients tend to develop lung metastasis. Now, one of the more common mechanisms as to how cancer spreads is our lymphatic system. So I'm sure we've all had a cold at one point, and for example, you have a sore throat and the lymph nodes of your neck can swell up. Well, those are lymph nodes, and these lymph nodes, which they're bean-shaped and sized little pieces of tissue that are part of our immune system, they're all interconnected through the lymphatic vessels. Now, cancer can also spread through our lymphatics, and that is a much more common way as to how carcinomas, for example, the more common cancer types, lung cancer, breast cancer, etc., tends to spread. So the last thing I want to tell you, usually, or unfortunately, once you develop metastatic disease or the cancer has spread, usually it does not have a cure. Now, there are some exceptions. Okay, so I'll give you an example. Colon cancer, if you have very little metastatic disease to the liver, there are occasions in which that patient with metastatic cancer or stage 4 cancer or cancer that has spread might still have a cure. So again, a quick recap. Usually, metastatic cancer equals no chance of a cure. But there are exceptions. So if you know someone that has been diagnosed with metastatic cancer, the most obvious or important question to ask is there still a chance of a cure? So have this conversation with your oncologist, because if there is a potential chance of a cure, that's what you need to pursue. Just also know that nowadays there are tests that we can do that can find or potentially find circulating cancer cells. So when these cancer cells make it into our blood, we can at times detect these circulating tumor cells or tumor DNA, and it also has diagnostic value. Again, I just wanted to throw that in there. There's a lot of advancements nowadays, so the take-home message here is speak to your physician. If they use the phrase metastatic cancer, it's just letting you know, unfortunately, the cancer has spread. Obviously, this is not a good thing, but always ask, is there a potential chance of a cure? So if you like this content, subscribe. I'm going to be making various videos. You know, the reason I want to do these videos, or I want to gauge them really towards patients and family. I've noticed that every patient asks me very similar questions. So I really do feel I can help a lot of people with these videos. And if you have a particular question, then please comment below. Just know that I am a practicing physician. I'm seeing patients all day long, and I do these videos on my off time, so you will not see fancy editing. You will not see all the fancy pictures. It's just straight to the point, and hopefully I'm able to help you out. So thank you.